Good morning and welcome to this webinar about the Reable pilot in Walsall. My name is Matt Boucher. I'm the moderator for this session and I work for Improvement and Efficiency West Midlands, an organisation focused on improving the quality and value for money of social care. Our local authorities are all concerned with getting the best value for money and specifically the best value for money out of reablement services, and they want to be able to understand whether or not stated outcomes are being delivered in reablement packages, whether reablement workers are spending their time actually delivering reablement, what the cost benefit is for providing reablement and preventative services, and a real-time understanding of operational issues as they arise. Improvement Efficiency West Midlands brokered this pilot with Walsall in partnership with Community Gateway and psHEALTH. We think there's some really interesting findings and hopefully you'll have the opportunity to raise any questions at the end. Enjoy the webinar, and I'll now hand over to Paul Davies, Executive Director of Walsall Council.
Okay, thank you, Matt. Good morning, everybody. Thank you so much for joining us this morning. You are all most welcome. Particularly warm welcome to Diane and Adele in Oldham. Hope you enjoy the morning. Very straightforwardly, what we set out to do here in Walsall was do something which has not previously been tried in other local authorities, which is actually work out just what it is that we were getting from our reablement services, because I think it's probably fair to say that in many places there is no direct means of gathering evidence for successful outcomes in reablement. We wanted to see if we could find a method by which we could look at the obvious thing, the inputs, the outputs, and more importantly the outcomes for people, and fit that into a method which took out some of the subjectivity and enabled us to use a system which ultimately we will be able to plug into our wider systems to identify where those benefits were coming from as opposed to the investment. You will have spotted, I'm sure, that government is setting a lot of store by what we in social care casually call reablement money, which is money aimed at ensuring that we keep not only the social care system functioning but also the NHS functioning, and it seemed to us it was right to have a close look at how we might use this money and the benefits that flow from it. So moving on then, our intentions were to reduce cost and to increase the independence of people coming through our services. We understood that this required a fairly significant service transformation, and to that end, in our case, our in-house service, through things such as our frail elderly pathway, have been through a major service reconfiguration and transformation. We began the Reable pilot in February 11, and it's a partnership between psHEALTH, who provide the software, and Community Gateway on the implementation. And the rollout, we aim for a very, very speedy rollout. We took a view that actually we would problem solve if any problems arose as we worked our way through, rather than going through a very extended period of development and then seeing what came out at the end, because the products themselves were sufficiently developed to enable us to do that without feeling that we were taking too much of a risk. So Reable works very straightforwardly. You will see there is a referral process, and within this it's extremely important that we identify, following assessment, the goals that we're setting for the individual person using the service, going through the service. Built into it is an activity tracking arrangement, and at the end of that an exit process, and the exit process comes complete with all of the information around that individual that we're looking to collect. So to kind of highlight that a little bit for you, then you will see that through the outcomes that we get information on the volumes, the intake, where the referral sources are, and also the suitability of people coming through the system, because I think probably in the world of social care we're very used to people being referred for reablement, often through the NHS, where people are not necessarily ready for reablement or suitable at that stage. The assessment, goals and activity tracking arena gives us some baseline assessment based on hours or activities of daily living, enables us to set and track personalised goals for individuals, to review our progress, and also we are working through monitoring that with the amount of time that our people spend, so call monitoring integration. So how many calls, how often, how many people, which if you can think of it as a sort of almost like a very advanced electronic home care monitoring, but activity related, rather than just attendance. And at the exit assessment end, then we get an outcomes report, information on team performance and utilisation, which I'm going to come to later on in the presentation. It's extremely important, and also something which reablement is not necessarily able to provide us in the traditional way, which is a cost-benefit analysis, some of which I've touched on already. And then the solutions, we have Reable, which is a 100% web-based solution, activity tracking against individual cases, and then a performance dashboard. And all of those are extremely useful management information. Okay, so how does it work then? How do we drive the change? Well, it is a step-by-step process, giving us a consistent approach. And I have to say, on a kind of personal basis, having looked at this, the package is extremely useful and extremely easy for our staff to use. So our own home care staff, many of whom have not previously been involved in using technology, are involved in this and understand how it works, and actually that's pretty good going. Activities of daily living assessment at the start, and we call that our baseline figure, and then the finish. Now, I'm going to come on to this in a bit because it's not related to time or anything else, it's related to activity. And within the process, it enables us to set personalised goals for the people coming through, which is extremely important. I think sometimes you will hear people talk about reablement as though it's a kind of block activity. Well, in fact, it isn't. It's unique to the individual in many ways, albeit that sometimes there are shared outcomes and goals and aspirations that people may have. Because we are looking to put good investment into this and to make it a core part of our business, you might expect that we've done what we would do, which is put an intense focus on data and management information, because really that was one of the key aims that we set out to achieve. So questions about where do our referrals come from? Why are programs not completed? Which anybody who's worked in reablement will know that sometimes people do fail to complete their programs, and there can be all sorts of reasons for that. Sometimes it's to do with the unsuitability of people coming through the system in the first place. Sometimes it's to do with perhaps further periods of ill health, or sometimes because the thing has not been thought through properly. So it's extremely important to us that we get that information. Also to tell us who are the people who are not setting goals. Is it the individuals themselves? Is it teams? And also, importantly, which of our teams is achieving good outcomes in a cost-effective way? So what do we do then? Well, we implemented a single care pathway for reablement in which people coming from a variety of sources, for example hospital discharge, will come through a single route to achieve their reablement goals. We benchmarked our teams on the activities of daily living and their productivity, and I will touch on that towards the end. We absolutely insist that all service users must have at least one goal that they must attain, and that enables us to measure effectiveness. And it also enables us to improve communication with our referral agencies and give them some good feedback on their activity and whether or not they're referring the right people to us, and whether or not they've perhaps carried out the assessments that they should have done in the first place, or what the effectiveness of those might be. So you will see this is an actual screenshot of activity levels within our eAble pilot, and this is showing you the number of referrals through the month. As you'll see, it gives us a full online reporting suite, and it enables us to exercise better control over the activities of the teams who are involved in enabling people to get back to maximum functioning. This is a really important slide to anybody who's in local government at the moment, which is how we measure our savings. And we measure this on outcome hours saved. So these are completed cases, and you will see that there is a very, very significant saving, around 1,100 hours saved, where packages have been able to be discontinued because we've reached that person's goals. Some packages also go up. You'll see there's a small increase. Others have a small reduction, and a still smaller amount stay the same, which tells you that there is in fact some activity going on in virtually every case, which leads us to some form of outcome for people. And you'll see we've got about 1,100 hours per week saved to date on here.